The price of things are raising. The persons in an accident. What is going on down the Middle East? What is going on Russia and Ukraine? What is going on in America? What is going on in the local economy and the country? And it's a bad news world, but we thank God that God is our buffer. He gives us good news in the times of bad news. So this is the good news company. We have the good news products. And we have the good news technology. Hear this one out. We have the good news doctor. The good doctor, Dr. Desmond Samuels. We need to get everybody on this call to hear this amazing doctor speak so eloquently, so knowledgeably, and so profoundly about this product technology that we have. Passion is in fashion, and Dr. Samuels has it all. So, ladies and gentlemen, I recognize your presence, and we start with prayer because prayer has brought us here, and prayer will take us on. Allow us to assume a posture of reverence and prayer as we say, Father, thank you for today, Wednesday, the 4th of September, 2024, a day we have never seen before, and a day we will never see again. Lord, we pray that you allow your children to use today to share good news with neighbors, friends, and relatives, that they can get rid of those besetting conditions in their body as they apply new technology that you have endorsed, you have caused to be made, and now we have it in our hands and inside of our bodies. Bless tonight, bless Dr. Samuels as he shares. Give him the gift of recall. Bless his mind, touch his body, touch his spirit. As he speaks, the knowledge will come back. We pray for Lady Marvel as she will conduct a certain part of this session. Pray for myself, my family, every family represented here, all our guests, all our returnees. God, we give you the honor. We give you the glory. We give you the praise as we say thanks. In Jesus' name, amen. Blessings, welcome, welcome, welcome one, welcome all. Wherever you're shining in from, a hearty welcome, Miss Lou would say. Welcome, welcome, welcome. Especially if you are coming for the first time. Bless you, bless you. If you placed an order between the last time we were here on Sunday night, was Sunday night until now, congratulations. You have ordered the thing them. It's on its way. And when you get it, bless it and take it. And see, after a while, you can say, look what the Lord has done. It's going to be a healthy time in your family, healthier family, healthier you. Look forward to a blessing. The most of the time we hear people with cancer, people with high blood pressure, people with arthritis, people with condition that doctors trying to fix for how long. They're trying their best to know, but the methodology, it's sort of crazy because I was hearing a doctor saying this evening, but a person has out of control blood pressure, high blood pressure, Dr. Summers can confirm it. They might need to use up to 6 different medications to get the high blood pressure under control. But you know what the 6 different types of medication is going to do to the liver, to do to the kidneys, do to the mitochondria, and will do to the microbiome. They're trying their best, and God is trying to help man to make it easier. And has He done that? So bless you, bless you, bless you. Welcome, welcome, welcome. Now we do the disclaimer, FDA disclaimer, part of the requirements, and it says these statements have not been evaluated by the Food and Drug Administration. The products discussed is not intended to diagnose, treat, cure, or prevent any disease. The information is intended for what? General information purpose only. It is not intended as a substitute for medical advice, diagnosis, or treatment of disease. Many persons may want to share a testimony, so we give a testimonial disclaimer. No one was compensated for giving a testimonial. All testimonials are the opinions of those individuals and may not be the results that everyone gets. Because some persons are saying something that the doctors are saying, whatever you are doing, keep on doing it. No, no, imagine somebody went to the doctor recently and the doctor said, you are too healthy to continue on these medications. Whoa, hold on. Can I say that again? Imagine if you are on different medications for many years and your doctor said to you the results of the test that was done recently have arrived and you are now too healthy to need to be on any medication again or anymore. How would you like to be that person? I would like to say to you, you are next in line for this blessing. Bless you, bless you. Now, I'm going to put on the good doctor himself early, Dr. Samuels. I've never seen a more my a doctor that is cool, down to earth, Iron and a doctor that knows his salt. Man, I tell you, this doctor here is a Google and Siri in one. You talk about AI, talk about DI, Desmond Intelligence, Dr. Desmond Samuels. You love him and you have not heard him as yet if you're on for the first time. Now, Dr. Desmond Samuels holds a bachelor's degree in psychology. He holds a bachelor's degree also in theology, and he also has a diploma as an electronic technician. He knows how to make sure that sound takes place, electrical wiring takes place, and electricity is flowing. Because a lot of that is similar to the body. He's an accident and emergency physician. What does that mean? He's in the ER room somewhere in Canada or somewhere in Jamaica. You will see him there sometime. He's a massage therapist. He's an expert in functional medicine because, among other things, he believes that plant life gives life. He's a mitochondria expert, and he's a mitochondria-centric doctor, as we all are on this call. The mitochondria is the center of our world because God has made it the center of our lives. Ladies and gentlemen, boys and girls, all and sundry, friends, Romans and countrymen, lend me your ears and give Dr. Samuels your heart as he speaks to you. Allow your mitochondria to be blessed. I present to some and introduce to others none other than the good doctor, Dr. Desmond Samuel. Sir, have you made it to the call, please?
Hey, Dr. Campbell, how are you, sir? How is
Yes,
everybody on
man.
the line?
Have some rain and thing today, so
Oh,
cool,
more.
cool, man.
As as you say that, I remember when I first came to Canada as a youngster.
Yes.
I was working at this restaurant called the Olive Gardens.
Oh,
So I had to take the bus to work, the subway and the bus and all of that. So the first time I experienced snow, I just stayed home. So then I saw the phone ringing and it was the manager of the restaurant calling.
yeah.
And he said, "Where are you?" I said, "I'm home. It's snowing."
Yeah. Eh,
He said, "Get your butt in here." I'm like, "But in Jamaica, when it rain, we don't go nowhere. We stay home."
sir. Holiday.
Our, yeah, our motto is more rain, more rest. So for the
Uh,
entire time, for the entire winter, they were just watching me. And every time I come in, they say, "Yep, he's here." But yeah, it was funny like that. I mean, cultures make such big differences.
indeed, indeed.
Yeah, so that's what I said to the manager. I said, "No more rain, more rest." And she's like, "Desmond, is it gonna rain tomorrow?" Folks, welcome, welcome.
Yes.
The emergency room is one of the most fascinating place in the hospital.
Mm,
As a physician there, you have to be like a counselor. You have to
mm,
be like everything. I remember I was preaching one Sunday. I preach at the church this Sunday. On Monday, that young lady that was sitting in the audience
mm,
was in the ER.
yes.
Oh boy, it never really ended well because she had an asthma attack and
Wow.
nothing we did could have brought her back. And I'm
Wow.
like, it was crazy.
Man.
It was absolutely messed up. Imagine having to go tell her mom she's not gonna make it. She didn't make it.
Mm.
40 years old.
Wow.
But the worst things you see in there is kids. We had a youngster. They rushed him in from Junction St. Elizabeth, and when he came, he just couldn't breathe. I mean,
Yes.
that's a peanut area. How do we have a child with a peanut allergy
In a
from
peanut area.
in a peanut area?
Wow.
Yeah, so it is one of them things, and when the folks come in, especially the men, you see, I don't, I enjoy, not really enjoy, I prefer dealing with female patients because they're gonna tell you the truth right after.
Yeah. Look at that.
The men,
Macho.
all when them are dead, them a tell you say, them a tell you
Yes.
like,
It's
like
interesting. You're listening, you hear them saying that I'm okay, but you have
yes,
your trumpet on their heart. You're just
everything,
saying, and
all
what
all
you're
the
hearing is saying
what
this ain't okay.
yeah, what I'm hearing and what I'm seeing and the results and the blood tests and all that. So said
Yes.
okay. They're just like, bro, you want to get fixed? Just tell me the truth. Because we had one case the other day where we asked the guy, did you take any drugs this morning? He said no.
Wow.
And he woke up in the middle of the surgery.
What?
Yeah, because the drugs, he took methamphetamine, plus he also took some
Oh,
some weed, and there was a drug
oh,
interaction. So the anesthetic never set, never get to set. Wake up right in the
mm,
middle.
oh dear. So what did you do in a case like that, sir?
Oh,
Because
when
he
he
took
wake up, oh listen, he woke up in the middle with his stomach wide open. He's a dead man. Cause that pain gonna kill him.
wow.
Mhm.
Mm. Why some you're supposed to write a book and a half, Dr. Samuel.
Yeah, this guy, he just died, right? I mean, the pain was so much, and they could have, because we were wondering, why is he shaking? What's going on? Because then the anesthesiologist was right there. But it no matter
Yes,
how much he up it, he couldn't up it enough because the other drug was there just blocked.
yes. You know, Dr. Samuel, I'm feeling ready to ask you a question, you see? And I'm going to
Hmm.
ask the audience to bear with me. Imagine that we go to bed at night and we are told that the average person lives about 35,000 days. So going to
Hmm.
bed at night is not a big deal. But how
Right.
often do we wake up and can't get up because the body feels stiff or one leg stiff, one hand
Hmm.
can't move, what
Hmm.
something wrong with one eye and the mouth feel different or somewhere the toe stiff upon you. Things like these do happen that
Yes.
we are getting up for thousands of mornings and out
Hmm.
of the blue one morning you just can't move.
And even better yet,
Yes, sir.
the last male that died from the US Supreme Court. He just lived, and then all of a sudden, one night he went to bed and the heart just stopped. That's
Hmm.
it. Beat for 78 years, and then it said, okay, I've beat
Wow.
enough. It just stopped, and so on. So, and we have a lot of those cases, and that is why a lot of times we do autopsy when we have problem cases, persons who have not been to the doctor and so on and so forth, and they die suddenly. We have to
Yes.
do an autopsy on
Also, so
those.
that could
So,
determine what really
yeah,
caused their
what
death.
really caused the death? Yeah.
Yes.
Um, so other things, there's a lot of stuff because sometimes we can have a plaque. We can have a plaque break off in the night, and when you're sleeping, that plaque break off, it gets into your heart, it gets from the heart into the lungs. Next thing you know, you're drowned. You wake up in the morning, all kind of stuff coming through your nose and your mouth, and next thing you know, you're a dead person. So there's a movie, another movie. I think it's a documentary, docu show, I would call it. It's called A
Yes.
Thousand Ways to Die.
Wow.
And when you see the amount of ways that people can die, it's a miracle that we wake up every day. Because
Yes.
when you sleep, you're very close to death.
Look at that. You're paralyzed because the body has to be paralyzed to stay
To
one
stay in that.
way because you
Hmm.
don't want to act out your dream. And
Right.
some persons, they just, because one of the reasons why I'm asking this, Mr. Doc, is that many persons say, I don't feel sick. I look in the mirror, I don't look sick. But
Mm.
then overnight, how could that be that? They didn't feel sick all these years. How all of a sudden?
You can have a heart attack, you can have an aneurysm,
Yes.
Stuff like those, they just happen overnight. Or the heart just decides, I've start beating from week 16 in the belly, and I'm ready to
Yes.
start.
My word.
We had a guy the other day. We had a student who died the other day in an exam.
In an exam.
In an exam. So I'm sure you have heard of athletes that have died on the track or on the
Yes.
field.
In the field.
There's a
Yes.
condition called HOCM, hypertrophic cardiomyopathy.
Yes.
And this is where the chamber, the left ventricle, is too small. So
Wow.
it does not have enough blood in it. So once you get stress and it's supposed to pump around, it's not pumping enough blood under stressful condition.
Wow.
But it just does not happen in athletics. It happens under any kind of stressful condition. For example, if you're in an exam and the exam stressing you out, your heart require more blood, and a lot of people don't realize that the body cells require more blood for you to remember stuff and to draw back on. And so
Wow.
right there in the exam, she just started sweating, and then she just fell right on the table and just died right there.
Mm.
Sometimes we have people pulling up themselves in exams. Exams are stressful, and even when you go to court, the judge will say, I sentence you to 5 years in prison. Better never say that because I just dropped dead right there and then.
Look at that. Eh?
So
Look
the
at that.
stress just went up. Yeah. But we can,
Wow.
while we are discussing, just before we finish, folks, I don't mind, and I'm sure Dr. Campbell and the others on here will say, I don't mind being a part of a group that you have as long as you talk to me about it first. Don't add me to a group that you have that I don't know what it is, because I'm just gonna exit it. I'd rather you talk to me about it first, ask
Yes.
me if I want to be a part of it, and let me say yes or no. But just don't add me to it just like that. Because this is not all I do. I have to kind of spread myself a little bit. All right. No disrespect, but just the way it is. All right.
Right.
We have talking of Doc.
Yeah.
Let's
Still.
talk about the mighty mitochondria. Unless you want to say something on that topic about the adding to groups and all of
Oh, that's fine. Yeah, you have said enough, sir. Please.
that. Okay. All right. Thanks. All right, folks. We're gonna talk about the tiny, mighty mitochondria. Remember, one of my favorite cartoons growing up was Mighty Mouse. This little mouse who would take on anything. Just the mitochondria here. It's one of these. As what you're looking on the screen here is a picture of a cell, a human cell. And inside our body, we have approximately 73 trillion of them, and each of them have mitochondria. If we look here, this one particular one has 2 mitochondria, and they have a specific purpose while they are in the cell. So the mitochondria is actually very, very potent and very powerful, as tiny as it is. It has its own DNA. So where the most of the cell have DNA comes directly from the nucleus, but the mitochondria inside the cell has its own DNA to boot. And that DNA that the mitochondria has come directly from the mother, the grandmother, and that line of the family, from the maternity side, nothing from the paternity side. Now, our chief executive person, Dr. Bevan Elliott, he is our scientist and he's our researcher. And what he said, he indicates that what affects health the most is the health of the mitochondria. Basically saying that you literally cannot be your healthiest unless your mitochondria are at their best. So the goal and what we're talking to you about tonight is how we're going to keep the mitochondria optimal. Are we going to find a way to get them to be their best? Now, if the health of the mitochondria can be improved and you have more mitochondria that are bigger and more energetic, then your overall health can be improved. The goal then that I want you to keep in mind is this. When we went to medical school, the first week of medical school, they tell us most, if not all, sickness and diseases are as a result of low energy. So that is, I want you to bear that in mind. Most, if not all, are as a result of low energy. So the mitochondria, by definition, is a membrane-bound organelle that generates most of the chemical energy needed to power the cell. It's biochemical reaction. So the chemical energy produced by the mitochondria is called ATP. Now, the human body, like I said, have approximately 73 trillion cells, and each cell in your body is powered by the mighty mitochondria. As tiny as it is, it's a mighty mitochondria. And so, how does it produces the energy? Now, the energy produced by the mitochondria, it does that by converting fats and carbohydrates into energy. We call it ATP. And those of us who did biology in school remember the god awful Krebs cycle, where all of that stuff happened, and we have to remember each and every step where we want to convert one molecule of carbohydrate to between 28 and 32 molecules of ATP. Now, the mitochondria then being the powerhouse of the cell, what it does, it is the main site of the ATP production, and it plays a vital role in calcium storage, amongst other things. But when we talk about calcium storage, especially when females go through menopause, then that is when they can start having stuff like osteoporosis, osteoarthritis. They just have a depletion in the calcium production. Also, then our heart also need calcium, because those calcium channels need them to pump the blood around the body. So with that, if the calcium is not there in abundance, then we can start having cardiac issues, high blood pressure issue, and all of that kind of stuff. These are the stuff that happen when the mitochondria is not at its best. Apoptosis, program or control cell death. The cells in our bodies are supposed to live a certain number of days, and then they die and are replaced by other cells. But sometimes, if the mitochondria is not operating properly, these cells can actually fly under the radar, refuse to die, and then become tumors, whether malignant or benign tumor. And not because a tumor is benign does not mean that it cannot be harmful. Because depending on where it is at, then it can cause problems. It could be pressing against blood vessels, could be pressing against your nerves, and so on and so forth. So when the mitochondria is right, these things cannot happen. Also, it aids in the detoxification of our cells. So, in other words, that as a human or animal, you just cannot live or survive without having the mitochondria. So, when the mitochondria is low, we get stuff like mitochondrial diseases. And so now science is now tying a majority of diseases that we're having to mitochondrial problem, mitochondria operating very poorly. Science is now taking a closer look at that, and now they are saying that the deficit in the mitochondria is basically what is causing these problems. So some of the stuff that we see them in pediatrics. We see a lot of persons, a lot of kids. Sadly, they have ADHD, they have autism spectrum disorder, have stuff like failure to thrive, learning disorders, all of those neurological issues. They are having seizures, all kind of stuff happening to these kids. So those are stuff that's happening because mitochondria is having problems. We can also have cardiovascular problems, for example, hypertension, stroke, cardiac arrhythmias, heart failure, atherosclerosis, and cardiomyopathy. We have those kind of stuff. We can be looking at stuff like neurodegenerative problems, Alzheimer's diseases, dementia, Huntington, bipolar. We look at stuff like mental health issues, depression, bipolar disorder, anxiety, post-traumatic stress diseases, ADHD. We look at some of the cancers. We talk about breast cancer, lung cancer, prostate cancer, lymphoma, leukemia. And then we can also look at stuff like endocrine diseases, folks, hyper and hypothyroidism, diabetes, goiter, PCOS. All of these have now been tied into what? Mitochondrial problem. Persons experiencing infertility issue, vision issues, erectile dysfunction. So when the mitochondria is low, it means now that you have low energy. And now with this low energy comes what? Inflammation. Inflammation doesn't come by itself because it's going to bring with it oxidative stress. Also, it's going to bring with it free radical damage. And so now we're going to continue to see a proliferation of all of these stuff happening to us over and over and over. But when the mitochondria is right, we get these stuff fixed, we get them sorted out. The body is such a unique, organism, that the way the body was created is that it has it has what it takes to heal itself. So, but in order for it to do that, it needs to have stuff like the mitochondria working right. So now it is up to us to understand this. And once we understand it, then we can now start helping the mitochondria to get to where it ought to be. All right. So, for example, we have our arteries. What do these do? These ones take oxygenated blood to they take it to the brains, they take it to the heart, they take it to the other tissues. Now we have a big artery in our body. A lot of persons don't even recognize it, but it's called the aorta, biggest one. And that's the one that takes when the left ventricle pumps that blood, it goes in it and it takes it right around the body, and so on and so forth. Sometimes in these arteries, what you see happening is that they get damaged because of what? Because of high blood pressure. Now, with this high blood pressure, what happens is that they damage the inside, because think about a hose, and if the water pressure is too crazy in there, and when you press that, it can damage the inside. So that's what's going on with your arteries. When that happens, the cholesterol comes to do some repair job in there. And in the process of doing that repair job, there is a lot of inflammation and stuff happening there. And so based on that, the plaque sometimes will stick to the wall. The plaque will actually stick to the wall of the blood vessel. And when it does that, then it over time it grows and grows and grows, and it can eventually becomes blocked, totally blocked. When it gets totally blocked, what happens is that whichever part of the tissue is distal to that is going to die. And so if it's brain tissue, that's how you get a stroke. If it's heart tissue or heart muscle, then that is how you get a heart attack. So we need to take time out to take care and to ensure that our mitochondria is right. Because when the mitochondria is at its best and operating properly, these things does not happen. All right, these things don't happen. So now I've given you all of that bad news. How about giving you some great news now? What do you do? How do you repair or prevent mitochondrial damage? This is where Dr. Bevan Elliott comes in. It took him 9 years of research and development to come up with 3 products that we're going to talk to you about. Product number 1 is the Ultra Mito Restore. How does it work? It works from the inside out, and it grows mitochondria to increase cellular energy and to provide your body with the nutritional resources to restore, regenerate, and repair itself physically and emotionally. Second product is the Ultra Mito Rejuvenate. This is a topical gel, and it works from the outside in. It works on specific areas of concern, as it is highly recommended for anything that affects your hair, your scalp, your skin, or any place on your body in an unwanted way. The other thing about this is that it penetrates deep inside to affect tendons, ligaments, muscles, joints that may be experiencing any kind of discomfort, any kind of mobility issues, any lack of feeling, or poor circulation. So, so again, this works from the outside in, and this is how and these are some of the stuff that it does. The Rejuvenate, then it comes in a jar like this, and the Restore is a liquid formulation. It comes in a bottle, and then now it comes also with an applicator that you're going to use to administer it. And then we have this third product. It is the Renew. It is what we call our brain and body. And all of them use the technology, we call it XDS, and all of them use that technology to deliver the ingredients to our cells, and not just to our cells, but they go deep in to take care of what's going on in in the mitochondria. We'll explain XDS in a minute. So, what is the XDS? It's the exponential delivery system, extremely unique, patent patent pending and all of that stuff. So, the rejuvenate and the restore and the renew, these all use natural ingredients that are amplified and driven deep inside the cells and into the mitochondria, again using this system. Now, what the XDS system does, and I'm sure a lot of us heard about nanotechnology and all of that stuff, but this goes beyond that. In other words, how this works is that it is basically right now the smallest particle of delivery that's available today. And how it works. Think about having a bucket of tennis balls that you're trying to get across a chain link fence. If you throw those balls against the fence, you will never get one to go through. But if you go up to that fence and you take those balls and you press them using some energy, they will definitely just go right through. No problem. However, XDS goes beyond that. Think about the same fence, and now you have a bucket of sand that you want to get to the other side of the fence. You just throw that bucket of sand against the fence, and guess what? Everything just crosses to the other side. And that is how potent the XDS system is. So with the cell now having this lipid bilayer that it has to get through, so it passes through the lipid bilayer, gets into the cytoplasm. And as we explain the ingredients to you, you will understand how powerful this is. So once it gets into the cytoplasm, there are other organelles in the cell that also needs to be boosted up and energized. So they get their product, and then the product is delivered now to the mitochondria, which also has a lipid bilayer. So that's why this XDS technology has to be so potent and powerful. And so it goes through the lipid bilayer of the tiny mitochondria and gives it its power. What is the purpose of the mitochondria again? The mitochondria purpose, it is the powerhouse of the cell. It is what energizes the cell. Now, once the cell is energized, then now it simply means that now the body is going to get to a place where it's going to start doing what it's supposed to do. So with the restore, let's talk about it quickly. It's an adaptogenic formulation, and what it's designed to do, it stimulates free natural energy from the mitochondria. That is going to outlast your longest day. So in other words, you don't need the energy drinks. And I was just going through some reading of some stuff on the energy drink today. These things are, I can tell it to you. I mean, I know Dr. Campbell read stuff, but I get stuff also that talk about this FDA stuff. I can tell you that some of these energy drinks, the amount of caffeine they have in them, they're actually causing a lot of young men, especially, to have heart attacks. Because the amount of caffeine and sugar in them is just way too much. One of the regular bottle cans of the Red Bull or one of them, it's about 27 cups of caffeine. That is way too much. Imagine you're gonna have now your heart going, you're gonna go into what we call tachycardia when you're having over 100 beats per minute. Once that start happening, you are now gonna be at the point where you can start having, instead of the heart pumping blood, all of a sudden the blood is getting clotty in there because it's not pumping, it's out of rhythm. But when your mitochondria gives you the energy that you need, then now it can outlast your longest day. So no more 2 o'clock slump. You know, when you're working and after lunch, then the IT settings at around 2, 3 o'clock, you just want to sleep and you need that fourth or fifth cup of coffee. You need that energy drink to get you through. Once your mitochondria is working, right, this is going to take care of it. Do you remember when you were in high school as a teenager? You never have these things back in the day. So what we are intending to do is to get your mitochondria back to that time when you were a teenager, and so that it can start producing and doing what the body needs it to do. So it enhances the brain's ability with the vision, the clarity, and the focus to meet your everyday need. It's a mood enhancement, and it relieves a lot of stress. You get more deeper and restorative sleep. It's a detoxifier of the cell. it enhances the immune system, and it just gives body-wide support for your major organ system. The other thing also about this is that this is the line that I really want you to take away from this presentation. The last line where it said it enhances the body's ability to manage itself and maintain homeostasis. Folks, that is key to this company, Mormito. That is the key to it. We are not telling you that the restore, the rejuvenate, or the renew is going to heal you. But what we're telling you is that they are going to get your body into homeostasis. They're going to get your body into balance. They're going to get your body back into equilibrium. And once your body is back there, it's going to start repairing itself from the inside out with this restorer. It's going to reverse arthritis. It's going to start reversing the effects of diabetes, reversing the effects of free radical damage. It's going to start reversing a lot of stuff. Imagine no pain anymore, no waking up 4 or 5 times a night to go pee anymore. Imagine your recall is awesome again. And imagine being able to come off those toxic medications that you get from us doctors. Now, here are some of the documented benefits of the superfood that are in this particular product. There's documented benefit of excessive fatigue relief, healthy blood sugar support, healthy blood pressure support, heart and cardiovascular system support. These are documented benefits, folks. These are not just stuff that we're talking about. You can find documentation on them. Cholesterol improvement, persons talking about having healthy and youthful hair, great weight loss, and immune response support from stuff like arthritis and fibromyalgia, rheumatoid arthritis, and all of that kind of stuff. These products are amazing. Now, the benefits of Restore are going to be especially important to persons who are experiencing an extreme energy deficit from the effects of medication. Medication, especially the ones that ends with VIR, those that you use to treat virus infection, whether it be herpes or HIV or whatever viral infection you may be treating, those medications are actually mitochondria killer. Now, athletes striving for extreme performances, they will see great results and benefit from this. No need to be concerned or worry about banned substance, because this is 99.99% all natural. So there is no need to worry about any of that kind of stuff. Those whose occupation require problem-solving abilities, talk about getting rid of the brain fog, just for working moms and dads, and for anyone who just wants to be as healthy as they can be. We're saying try Restore today and launch a rescue mission for yourself. Now, how do you take the Restore? The recommendation is to take 4 milliliters per day at a loading dose of double or more for the first few days. And you can take it in the evening or in the morning, or a single dose, or you can split it up. Now, when the Restore comes to your door, it's going to come with an applicator. So what you're going to do, you're going to take that and you're going to take 1 milliliter at a time. You're going to put it under your tongue and just squirt it there under your tongue and just hold it for between 1.5 minutes to 2 minutes, 1 milliliter at a time. So if you decide to take 4 milliliters in the morning, then you take one first, then you take the second one, then you take the third, then you take the fourth. Don't take all 4 at one time. Don't even take 2 at one time. And that's going to cause your saliva gland to produce too much saliva, and it's going to take longer, and it's going to be more difficult for it to be absorbed. All right. Now, I was just reading up on some stuff today, and I was just checking it out. And I am going to recommend that you take the Restore half an hour before breakfast in the morning for your first dose. So I want you to take it half an hour before breakfast. So you get up, pray your prayer for those who pray, wash face, brush teeth, and all of that stuff. Take your Restore. Take your 2 doses, your 2 milliliters, or your 4 milliliter first thing before you get into the kitchen. Give it some time so that now it gets into your bloodstream. It's not competing with the sugar from your coffee. It's not competing with the caffeine from your coffee. It's not competing with the carbohydrates that you're going to eat within that half an hour time, because it goes directly into the bloodstream. By the time you start eating, everything is taken care of. So that is how I want you to take your first thing in the morning. Give it about a half an hour before you consume anything. And then now, if you're going to take it throughout the day, you can continue to do that. But the first dose, I believe it's best to take it a half an hour before. So I would say if you're doubling up or tripling up, you do that in the morning, half an hour before you eat. Now, how quickly do you expect to see results? You can see results same day. Some folks have reported that. Most people report benefits though in days or weeks. Now, in some instances, sign that your body is detoxifying. For example, you might have a headache. You might have not a pounding headache. You know that those annoying nagging headaches. You might have one of those. You might feel tired and lethargic, a little bit more sleepy. That is because toxins are being driven out of your body. Your body is getting detoxified. That is what is you're experiencing. The other one that you might experience is that some folks have not been going to the bathroom on the regular, maybe 4 or 5 times a week. When they start taking this, they realize that they're probably going there 4 or 5 times per day. And it's not about watery diarrhea. It's about getting rid of the stuff that's been stuck in your colon for weeks, if not months. All right. Now, if you have complex issues, hear me clearly. If you have complex issues that you're dealing with, that you were taking medication for the last 10, 15, 20 years, it's going to take you some more time. You have to be a little bit more patient. But also in the meantime, you are going to need to be more aggressive and intentional about this thing. So you're going to need to take maybe 4 milliliters 3 times per day, minimum, if you've been dealing with these complex issues for a long time. All right. And that's how you're going to get your best results. All right. Now, these are the ingredients that are in this Ultra Mito Restore. Again, it's got the virgin olive oil, the black seed oil, and the olive leaf. Those are the main ingredients. But then there's anti-cancer ingredients in here. There's anti-diabetic ingredients in here, anti-hypertensive. There's ingredients in there that will help to deal with your cardiovascular issues, your libido issues. Those of you who are taking a statin kills the CoQ10, which your heart needs. Then there's CoQ10 in there to kind of help to restore that. There's just so much in there. There's stuff in here for your mood enhancement. Just this one product alone would be enough to really get you on track. But read up on the all 44 of them and then you can see. But so all 44 products. So the reason why the company is saying you should take a minimum 4 per day, in that 4 milliliters per day that you're taking is the exact amount that you need in order to help the body to start the repair, the restore, and the process that it needs. All right, to get it back into equilibrium, so it can start doing what it needs to do. Why is it that the persons are talking about they're getting great results with their eyesight? Got the vitamin A in it. It's got the vitamin D3 in it. And so those are really what helps that. How is it that some men are reporting that the bedroom is good again? Number 22, it's got the maca root extract in it. All right. So it is really amazing. Some of the stuff that are in here. Now let's talk about the Rejuvenate. It is our topical gel. It takes care of anything that itch, scratch, break out, or irritate. Persons who have joint pain and discomfort, random bumps and breakout. Persons are reporting great results from reduction and removal of fine lines and wrinkles. Sunburns, sun damage to your skin, those are being replaced and repaired. Insect bites, persons who have dandruff issues, and also persons like us, when some of us have razor bump issue. It really helps with those. So any kind of scar that you have, any wart, any skin tag, anything like that, it basically really helps with it. Now, persons are using it as a natural deodorant. Now, when you go to the drugstore or you go to the department store to buy your deodorant, folks, please take some time out and read the label. And anyone that has aluminum in it, please don't buy it, because Science is now telling us that it's causing lymphoma. All right. So with that in mind, persons are using our Rejuvenate as a natural deodorant. Hairstyling, it's repairing damage here. You know, persons talk about having split ends and all of that. They are getting reviews from even when they go back to their hairdressers. They're saying that, oh, I thought you were coming in to get your hair split, but when they look at it to get your hair ends cut off because of the dead hair, no, hair alive again and bouncing all around. Persons who are having foot pain, from peripheral neuropathy, from nerve damage because of maybe diabetes or any other thing that's going on in the body. You're feeling pain from your toes all the way up, and then muscle aches and pain. We're having some great results because persons are using the Rejuvenate to fix those problems. Persons are talking about sinusitis, their sinuses being repaired and being healed from it by just putting it on a Q-tip and massage it in your nostrils. Pretty much know your sinus infection is fixed. So the Rejuvenate then can be especially important to persons who are looking for, who want younger looking skin, who wants a natural alternative to medication and discomfort. You know, some of those balms that you use and rub, the smell make your house smell like you're in a nursing home. No, this can actually step in to fix that. Persons who are looking for sharper vision and a quick relief from eye strain, this is great for that. Or even for those who wants to pursue a more vigorous athletic workout, they will find out that they recover more quickly. Persons who just wants to be as healthy as you can be with less emotional stress and discomfort, this really, really works. So now kids are going back to school, they are getting into athletic programs, they are getting into athletic activities. They're gonna come with sore muscles and joints and all of that. This is really, really good for that. So how do you take it? So we recommend that you order both Restore and Rejuvenate together. And then when they come to your door, you're gonna take 1 milliliter of the Restore and you're gonna put it in the bottle with the Rejuvenate, stir it up together, mix it so it becomes one. And then you're gonna thoroughly massage Rejuvenate into and around the affected area. You're gonna reapply multiple times per day or as needed. And you're gonna continue to use it even after the discomfort is gone. And this is going to give you a more complete recovery. So, like for my ladies, I mean, once you especially when you do the combination, you put it on your face. Oh my God, you get such a beautiful glow. You don't even need them foundation powders that are made with placenta anymore. Just look hot like that. Now, again, for some issues, you're going to see results within minutes. Other issues, including like skin tags, skin anomalies like moles, warts, and skin tags. Again, anything that is very complex, they are going to take a little bit longer. You have to be more patient. All right. So it really, really works. These are the 22 ingredients that are in the Ultra Mito Rejuvenate, and persons are just no more pain, no more joint discomfort, no more muscular aches. Some persons were reporting that they get out of their bed in the morning and they were terrified about putting their feet on the ground. All of a sudden, they don't have that problem. All right. Now let's talk about the brain and body, the Ultra Mito Renew. So this is going to take your physical performance to another level. This brain and body will take your mental and physical performance to another level. It was created by our chief scientist, Dr. Bevan Elliott, and it is created to work in concert with especially the Restore and Rejuvenate. How? It's going to give you the power to be your best. It's going to give you the power to be your absolute best from every cell, from the cellular level. Now, let me just ask you these questions. Is your vision as good as it used to be? Do you have less strength and stamina than you did when you were younger? Can you remember things as well as you did once? Is your mind as sharp as it was? Has it become more difficult to maintain your blood pressure, blood sugar, and the proper weight? Is your immune system as strong as it once was? Do you bounce back from injury or illness as quickly as you once did? Or does it take longer? If you answer yes to any of these questions, you need to order your product like right now because it is telling us that your mitochondria is in deficit. Your mitochondria is under attack. Your mitochondria needs some help. You see, the brain and body adds another dimension to the more mitochondrial strategy for health, wellness, and personal empowerment. It brings you now the water soluble ingredients, which add an additional effect in the growth for the mitochondria. Now, this complements and extends the benefits of the oil based ingredients in Restore. So, the Restore, it is lipid soluble. The Renew is water soluble. So it means now that every area of your body will now be getting exactly what it needs from these two. So because the Renew now is hydrophilic, love water, parts of the Restore might have been hydrophobic, don't like water. No need to worry. With them both, with the combination coming together, your body now got everything going on. And then with the rejuvenate from the outside in, affecting everything that has to do with your skin, the every cell in your body is going to be now affected because the mitochondria is now going to start getting back what it needs. So when we talk about cause and effect, remember we told you that the cause of all disease and sicknesses is low energy. The mitochondria is the energy source of the body because it's the energy source of each cell. So now, if we find out whatever it is that you're dealing with, once the mitochondria is in deficit, once the mitochondria is not operating right. So based on scientific research, folks, a decrease in energy production by the mitochondria in the cells of our body and poor functioning of the mitochondria is responsible for numerous dysfunctions in the body and result in diseases. So now what we are doing now is telling you if you can get these ingredients into your body, into the cells, get them back into the mitochondria, then now we are going to start seeing the reversal of the effects of inflammation, the reversal of the effects of oxidative stress, the reversal of the effects of free radical damage. And now we're going to also start seeing that these diseases and chronic pain that are as a result of inflammation, oxidative stress, free radical damage, and the results of aging, we're going to start seeing a reversal of these things. And this is what this does, because now the body is now back in equilibrium and it's going to start fixing what needs to be fixed from the inside out and from the outside. So whatever it is that you may be dealing with or suffering from, chances are it's a result of mitochondrial deficit. It's a result of poor operating mitochondria. And so this is what these ingredients are going to do for you. So how do you get your product? How do you get this technology? You have to get back to the person that invites you here. Get back to that particular individual. They're going to send you their personal website. You must sign up as a referring customer, order your products, and then you can start enjoying the benefits of this great technology. So that is what is so whoever invited you, get back to them, and then once you get back to them, then now you can they're going to send you their personal website. When they send you their personal website, then now you are going to go ahead, sign up yourself for free. It's a free sign up, and then you are going to see they're going to send you a link that looks just like this. That's what I'm circling here. So they're going to send you this link, and then now when you get ready to purchase, you go here where it says shop more Mito, and you're going to click on where it says click on that where it says people product or people health product. This is different. Good. So once that happened, Then what's going to come up, you're going to see Dr. Bevan Elliott talk about the stuff that he has done. So the restore, the brain and body, and the rejuvenate. Then you scroll down, and that's what he looks like right there. That's Dr. Bevan Elliott right there. And then you scroll down a little bit, spend a little time, go through these testimonials. You will see what other persons have dealt with and what period of time it kind of helped them to get over what they were going through. And then you're going to go to where it say buy now. So click on buy now. And the encouragement for you is to buy in bundles. All right, buy in bundles instead of buying them individually, because with the bundle packages, the value of the bundle package is about $200, but then you are getting it for $150. And then we scroll down here, so we show you how that works. So we have these bundles here. So bundle number one, the standard bundle number one, you get, as they look at it here, you get the Restore 3.0, you get one Rejuvenate the jar, and then you get a second one for free. Cost of that, $160. However, if you put it on AutoShip, say yes to AutoShip, they'll give you an extra $10 discount. Bundle number two, here is, it comes, if you look at it, it comes with the Restore, comes with the Rejuvenate in the jar, but then it also comes with 12 mini Rejuvenate. These are what you should give out to your folks, so that if you know persons who are suffering from pain and eyesight problems and so on and so forth, you just give them one of these and let them apply it, and it will actually give you some. Once they like it and love it, then they will come and they will purchase from you, and you do get commissions when other persons purchase from you. You do get a commission for that. We can go into that in a bit. And then now we have another set of bundle. You can just go through them, but I want to talk to you quickly about the brain and body bundle. So if you do the brain and body bundle, you get the Restore, you get the brain and body. So you have the hydro, so you have the lipid soluble. Then over here, now you have the water soluble, and you get a free Rejuvenate for that. All right, so on and so forth. So that is basically what those are. And you can go down and go through them. Now, for those of you who are dealing with stuff for the last 15, 20, 25 years, you've been taking these crazy medication. Hold on 1 second, please. Sorry about that. Right, let me just say it then. For those who have been dealing with chronic illnesses for the last, say, 15, 20, 10, 15, 20, 25 years, you've been taking this hard medication to deal with the symptoms of your diabetes, your high blood pressure, and all of that. I would suggest that you get this guy. Or any one of these. Or you can get this guy here. The reason I'm saying that is that I would like you to get the two Restore. And for the first one, when you want to go hard with it, you want to just go take 4 milliliters maybe 3 times per day. And so you're going to attack the symptoms of what you're dealing with. You go hard with it. And then after you do that, then you can now go with the second one and then start using it at a 4 milliliter per day. But you want to give your system a boost and a big, big jolt. All right. Now, there are power bundles that come with 2 Restore, 2 Rejuvenate. And then if you look at these, the Restore by itself is for $110. The Rejuvenate is for $60. And the if you have the Pet Life also, we could talk about that. And then the brain and body, these are tablets, these are capsules, and you take 2 of them once, take 1 of them twice per day. That's how you take that. Try not to take it too late, the second one, because you probably won't even be able to go to sleep. And then for those who want nutritional counseling, you can get, for $30, you can get counseling from a certified nutritionist, Dr. Dan. He comes on the corporate call on Saturdays. So basically, this is for your health, and this is for you to take a seriously good look at it, get your questions answered, get back to the person who will bring you to this call, and see what it is, how we can actually aid you in getting these great stuff. So that is it from for now from me. So I'm going to turn it back over to Dr. Campbell.
Hey, great, 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 Dr. Samuels. Amazing presentation, sir. We always know that you can't go any and anywhere on the internet and get quality information of this type. Look at the information. It's the first time human beings are able to talk like this because we have something we have never had before. So we're now able to do something we have never been able to do before. So thank you very much, Dr. Samuels, for explaining the information in such a way that children on the call could even understand it. And I'm sure that many first timers are in awe to know that something like this is now available so that we don't have to live with the things that we have been living with. And definitely we don't need to die from the things that our family members keep on dying from, because God has given us a balm, He has given us an oil. And you want to see our family members, I don't know what is happening in other families in other countries when they get their products. Rub, rub, rub. Hey, from head to toe. Any little thing, rub. Any little pimple, serve it notice, rub. Any little bump, rub, rub, rub. Any bruise, any mosquito bite, you rub it. Any bee sting, wasp sting, you rub it. Any fine line, any wrinkle, any headache, any neck ache, any back ache, shoulder ache, side ache, arthritic pain, muscle strain, ankle pain, any form of swelling. Because you know, life funny, you know. Overnight, some swelling come up on the body or during the course of the day. So where the swelling come from? You just rub, rub, rub and say swelling go down. Foot back to normal, skin back to normal. And then you're taking it on the inside and you're rubbing it on the outside. And look, you know, back up come. We have. We have the brain and body. Wow. In Jamaican parlance, you say, your things are done, but just a come. Because we turn up things now with brain and body as a booster for the rejuvenate and the restore and working better. I heard um, Sherlock attested to it the other day that he's a brilliant man, genius he is, and he's a Harvard graduate. When you hear him say that he believes he's operated more intelligently, I think I understand what he means. You're having the gift of recall, mental clarity, mental alertness, mental energy, a sense of well-being. You are remembering stuff. When you're reading stuff, you are understanding things you had difficulty understanding before. And you are discerner of things and you're remembering where you put things. It's just a different life. It's a different experience. It's a rebirthing of your cells mentally and physically. And if you ever want to get your health back on track, ladies and gentlemen, you have heard it from the doctor himself, the good doctor, Dr. Desmond Samuels. So make plans, make preparations to get your product and to utilize it and enjoy a better quality of life. Now, ladies and gentlemen, we are going to have question and answers. Lady Marva is going to conduct that. But I just wanted to know that this company did not come out of the blue like that. We have three founders. We have our CEO, Mr. Roger Hill, one of America's brightest sons. Worked at NASA space program before the Pentagon says, we need your brilliance of your mind to give direction to the country and give answers to the presidents. And can you imagine the presidents over a 20 or so year period depended on him for logical answers and to be a big part of conversations and problem solving and such alike. But when he had issues in his tissues, he teamed up with Dr. Bevan Elliott. Brilliant, brilliant man, because a brilliant birds of a feather, flocks together. And a brilliant mind knows another brilliant mind. And they teamed up with Dr. Bevan Elliott. He is no ordinary scientist because he asked God to help him to make a product to help people to die of old age and not to die of disease. You see, he, like the average family, goes up and see friends and family members dying from the regular chronic degenerative diseases, living in pain, living cancer, dying from, you know, the things that people die from. And he says, God, help me to make a product. Help me to be kind to mankind. And Jesus sent him to school, university, learned what he had to learn, all the sciences he had to learn. Brilliant mind, he learned it, but he came back humbly and he knelt at the feet of Jesus with all his accolades from the scientific community and said, have these sciences touch me divinely, touch my mind and my spirit and give me understanding to make the product to help people to die of old age and not to die from disease. Did God answer his prayer? Ask that little boy who was autistic for 7 years, couldn't speak a word, and he's now speaking. Or that 10-year-old girl who has not spoken a word from she was 2 years old. And now 8 years later, she's calling her friends by name, saying mama, and adding new words to her vocabulary. Ask that man who got a stroke 13 years ago, lost the use of his right arm. It was just an appendage hanging there dead. 3 or so weeks on the product. He's using that arm to feed himself. He's participating in the body's activity again, feeding himself, holding spoon, holding fork, and feeding himself. Or ask that lady who was damaged in a bomb in Iraq some 20 years ago, and a bomb went off under a lorry, blowing a hole in her face. Long-term memory gone, short-term memory gone, suffered from post-traumatic stress disorder for 17 years. Same day. Did I say same day? Same day, she got her technology, memory came back after 17 years. Post-traumatic stress disorder is a thing of the day, of the past. And she have a short-term, long-term memory, go to the supermarket, and she just buying things out of her mind. She don't have to write down every single detail of her life every day before she leave home anymore. So ladies and gentlemen, what are you struggling with? What is your complaint? What did you wake up with this morning that you're trying to correct for the last 5, 10, or 20 years? What have you tried? You now need to get the more mighty products, bless them, take them, and see what Jesus will do with them inside of your body. I ain't going to keep it much longer because I don't want to stay in the ray of greatness. Because I'm going to invite right now, I need to mention the third person is Mr. Dale Bonet, our president, and he is just a smooth talker. He's the man. Butter under his tongue. He's the president, and he gets thing going and get your order out. So, Lady Marva, please open the microphone and facilitate persons who would like to ask Dr. Samuels any questions, or
Thank you, Tom.
also for persons who may have a testimonial to share in a timely manner, kindly indicate who to speak accordingly. So, thank you, Lady Marva. Please take it away.
Thank you very much. And the after word is timely. Thank you, ladies and gentlemen, for sitting through to this point of the evening. What an awesome presentation, eh? So if you want to speak to the doctor, let him put his money where his mouth is. You may raise your hand, your digital hand, by selecting the reaction button. I will give you the option to go ahead and raise your hand, and I'll give you a call and say, hey, time to you can open your mic. But please, I'm asking, don't open your mic when somebody else is on. It's your background ruins the ambience. So we ask you, please don't open it until you're asked to. And thank you so much. And there's you can also write in the chat. There's some stuff in there already. Um, so doctor, are you ready? Did you have a sip of your water? You ready, sir?
Yeah, I'm
Oh,
ready. I'm ready. I did have a
okay.
sip of something. I wouldn't say what.
You see now, I didn't say water, I said water. The
Um,
problem. Hmm?
the there's the question that was in there about the does it have blood thinner in it? No, It does not have blood thinner in it, but it have ingredients in it that will regulate the blood. Because a lot of us have dirty blood, and instead of the red blood cells, flowing around freely in our body, they are clumped together and all of that. But it has stuff that can separate them, that cause them to separate, and we do have that. All right, but no, it doesn't have blood thinner in it. And I'm glad you asked that question, because I would just like to address folks who are on blood thinner. You got to make sure that you're not drinking too much garlic tea, because garlic is actually a blood thinner.
Mm.
And the person
Okay.
that the Mediterranean, whenever a person's coming with heart problem and we do like heart surgery and stuff, we kind of tell them to do the Mediterranean diet, because that seems to be one that works. So that person that asks if doing it for weight loss, the Mediterranean diet would be a good one.
Okay. Wonderful. Thank you. And the problem with the rejuvenate is a statement and then a suggestion. The problem with the rejuvenate is that it finishes too quickly when you try to rub an area of your body. I am recommended that they bottle it in a larger bottle. Food for thought. And
I don't know. I don't know about the putting the capsule in the restore. I wouldn't do that, because the capsule is more of a water soluble thing, and the
yes,
restore would be more of a lipid
oil.
soluble. So I wouldn't do that. For macular degeneration, absolutely, 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 absolutely. We have seen stuff where persons are getting regrowth of tissues, regrowth of tendons, regrowth of ligaments. Yeah, so all of that is kind of taking place
Yeah.
here.
Our CEO say you can open the capsule and put it in liquid, like no water soluble thing, like you're saying, right? But it says, man, it tastes bad.
Yeah, I wouldn't. There's a reason why they hide it in that. It's just like some persons cannot take pepper, and so they can
Mhm.
buy the capsules and put them in the pepper, because the pepper actually helps to cleanse your blood. Our good old,
Mm.
our good old peppers from the Caribbean. Yeah,
Yes,
they
that's
do.
what it.
Put them in there, put them in that thing, and take it, and it's a blood cleanser.
Mm-hmm.
Now, when the question for Nadia, do I have to mix the one? You just do it one time when they arrive at your door, just one time, and then once you put it in it and mix it up, and that's fine. You don't have to put it in every time. You put it in one time, just one time.
Alrighty. Let me check for hands. No hands up. It's gonna look like we're gonna be a nice and easy cruising night tonight. Nobody's raising their hands. Woo.
Hmm.
Okay, don't wait till the last minute. We're not gonna keep the doctor too long tonight.
So yeah, folks, if for folks who are out there who I just want to mention, I know we did a presentation with Dr. Bloomfield a couple of weeks ago, and he was talking about renal failure.
Mhm.
Um, so it's not just the color you want to look at when you go to the bathroom to pee. Make sure you pee in the water that is in the toilet bowl. The reason I say that, you want to see how much it froths. All right.
Oh.
So yes, yes. Because if it froths a lot, it could mean that you're having some kidney issue. Because it means now that it's not reabsorbing the stuff that it needs to reabsorb. So if it froths a lot and stay long, so sometimes just to check it out, don't flush it immediately. Just leave it for a good 10-15 minutes. And if you go back and it is still frothy, then you need to get your stuff checked out. So pee in the water and see how much froth you get. Men, make sure you hit the water. And then women, same thing. Because if it's very, very frothy, then it could be sending you a message. So it's not just the color we go to look at for that. All right. So I thought about that today, and I thought I would mention it. And
Okay.
then you also want to look at your stool. Again, I know it's probably sound gross, but when you poo, it is supposed to look like a ripe banana when you peel it, and so on and so forth. That's a healthy poo. So if you want to see what the poo is, just go check the Bristol stool chart, and number 4 is the healthy poo. All right. And again,
Okay.
you always want to look for blood. You always want to look for other kind of abnormalities.
Parasite.
parasites. Now, especially when you start taking the restore, you're gonna want to start looking for parasites and so on and so forth. And please try not to be overly constipated, because then no, that can get to the point where you're gonna cause hemorrhoids. And hemorrhoid surgery, trust me, it's not something you want to. It's not a road you want to go down. Hemorrhoid surgery is nasty. It's painful, and it takes long to get better. All right.
Yeah. Wow. Can it be used for fibroid? Yes. Go ahead, please, doctor.
Definitely can be used for fibroids. Definitely, because again, fibroids, it's all a breakdown. It's caused by inflammation. It's caused by other stuff that are not working right. Again, it depends on the size of the fibroids and how long you've had it. If it's something that's been there for a long, long time, advice is just to take it out. But if it's just, find out it's just coming and it's just starting, now you want to prevent it because of maybe family history of it, then it does work well for that. And one of the things that our men, need to start doing, or you need to start getting your woman to do it for you, is that you need to start doing a prostate massage. Don't beat up on me yet. I'm not talking about I'm not talking about doing the prostate massage where you're gonna put your finger up in the anus. I'm not talking about that. They're about halfway between the scrotum and your anus. That is where you do the prostate massage. And you need to do that for about 10 minutes. So you could so what you want to do when you feel right there, you're gonna let the guy lie in a fetal position, but you're not going up his ass, up his anus. You're going halfway between the balls and the anus, and you're gonna feel a hole there. You're gonna feel two bones on either side. You're not going to press too hard because his nerves and his stuff are running through there. And then you're just gonna rub it in circle, in circle, in circle. That will help the health of the man's prostate. All right. So it does work. It's a good thing to do maybe 3 times a week, but 10 minutes at a time. So you're gonna feel like a little hole there when he lays in the fetal position. Yeah, or he can lay on his back and kind of open his legs, and then he can do it himself, or let his female partner do it for him. All right, so that kind of really helps to stimulate the prostate and to get it going. So there are persons out there who do massage therapy, and they will offer to do it anal for you. That's your business if you want that. But nope, I don't want that. But so you can do a prostate massage from the perineum, and it works just fine, with or without the rejuvenate. Go ahead, Andrea.
When you say Andrew, I thought you were talking about me.
Good night, everyone.
Good night.
Yes, in 2021, I had the COVID vaccine done in New York. However, what I noticed now is that I did it in my right hand on my shoulder. And what I noticed now is that I'm having tremors in my hand. It is bad that sometimes I can't even hold a pen to write.
Oh, so you're right-handed, right?
Yes.
When did this tremor start?
2021.
It started the same time you got the shot?
Like a few days after.
Wow, they hit your nerve, man. Somebody, some rookie they make you that.
Yeah, because the needle was very tall.
Yeah, so there's some inexperienced nurse that let give you that shot. Yikes. We do this technology does regrow nerves. Nerves are some of the most difficult things in the body to grow, but it does work. So you would have to start doing the restore, rejuvenate, to massage it even 4 or 5 times a day, because it goes deep into repair tendons, ligaments, nerves, and muscles. So yeah, you can get your release. Oh, sorry about that. Somebody hit something wrong.
Wow.
Yeah.
Okay. Okay, thank you so much. Let me get this next person. Okay, so the next person will be my thing is just jumping. I'm so sorry. Candice.
All right. So for the person that is dealing with the nail fungus, what you're gonna do again? It's the mixture. Which nail are we talking about? Are we talking about the Are we talking about fingernails or toenails? Well, it shouldn't really matter. Okay, here's a couple of addition stuff that you can do for that. So for the nail fungus, it's gonna be multiple times per day. You're gonna use it with the You're gonna do the restore rejuvenate. It's gonna be massage it really nice. All right, but in addition to that, you can also get a foot bucket and you boil the apple cider vinegar, add lemon and baking soda to it, and then you can soak your toenails or fingernails in that. That also helps a lot with that. All right, so you're not gonna cook your foot now, you know, you're just going to tolerate it as hot as you can and just soak it in it. And even when it's cold, just keep your foot in it for another good 15 minutes.
Yeah.
And it does knock out the fungus. So it's apple cider vinegar, not the Bragg one that you're gonna drink, just the regular apple cider vinegar. You're gonna put lemon and baking soda in.
How often that has to be done?
Once a day for about a week.
Okay, thank you. Candice? Can you open your mic now, please? Candice?
Yes, good night.
Okay, good night.
Good night. I want to ask a question. With the product them for Tobago, right? We have a lady named Sophia Murray from Trinidad, right? The product just come directly to she, and she does send it for me in Tobago, right? It's
Okay.
partly, we could say about 2-3 months now. I'm waiting to get in the next gel now, right? Apparently, it was the 2 gel and the liquid was to come, but she said that you all hold back one of the gel them. So I'm waiting on the gel so long, over
Okay.
a couple months now.
Let me just address that. Okay, so we're just marketing for the Caribbean group. We don't really do that part of it, but there is I think you can get the information from Marva of the number that you can call, because even some of us are waiting on some back orders as well. So we don't have yeah, so we're just doing the marketing wing for our Caribbean group here. But to deal with the logistics stuff, you gotta go through the president. So Marva will get you. Talk to Marva, get her information, and then you guys can kind of work through that.
Okay, I'll send it to her.
Okay.
Okay. Let me see who's next. I'm sorry?
Yeah, all right. Miss
Okay.
Marva, you have to give me some number or something?
Yeah, she's gonna send you her number, yeah. Private. Just check
All
your
right,
message. Okay.
Yeah.
I sent it to you privately
All right,
in the chat. You're welcome.
Okay, thank you.
You're welcome, dear.
Yeah. All right.
Okay. So our next hand up is Beverly.
Hi, good night. Good night, doctors, and good night, everyone.
Good night.
I have 2 questions. I personally have a problem with my right leg, right around the shin area. It gets hot, like a hot flash, and it will go away. And ever so often, when I think it's over it, I'll feel it again. It will come back, but it's not constant, and it's not. But it does come and go.
How long it lasts when it comes?
Less than a minute, but it just comes like a hot flash, and you can actually feel it, hot and dissipated on my skin. Yeah, that's so strange.
Sounds like nerve issue. Sounds like nerve issue. So we just have to. So we'd have to go from we'd have to do a lot of massaging behind your knees, and then down to
Oh,
that, and then down to that point. Because yes, it's right
okay.
behind. You're right behind your knees. There's a lot of action going on there. Lots of
Oh,
action going on there.
I
Lots of
really hurt
action.
my knee, and there's a bit of pain in my under the kneecap on the same
Ye-
right leg.
Yeah, the patella. Yeah, so
Yeah.
that is some things going on in there with your nerves that we just need to get fixed. Yeah.
Okay.
Mhm. And it's the
And
rejuvenate, restore. That's the one you better do. You're gonna
all
just
right.
massage it in. Yeah. So you're gonna
Yeah.
do you're gonna do so you're gonna do the patella, sorry, the kneecap, and then you're
Uh-huh.
gonna. So how you're gonna do it is at the sides,
Mm-hmm.
and then now you're gonna do behind your knee, behind that there, and then that will actually get it deep.
Okay. Okay. Thank you. And
Well,
also, my sister has arthritis, but the two knees, it's bone against bone.
well,
So the
we have had testimonials of that.
oh,
Persons are jumping up and walking around again. So yeah.
okay. So it's the same rejuvenate and restore.
Same rejuvenate restore.
Wow. All right. Thank you.
You're welcome.
Thank you very much. Yeah, bye-bye.
Thank you. You sound good already. Ah. Good night. I have some new members on the Zoom tonight. One of them have lupus.
Again, lupus, just like any other of those autoimmune diseases, we get the mitochondria right, we get it fixed. But again, they have to be intentional about it. They really have to, because even if they go on the testimonial site, they will see where persons have actually had reduction in their lupus medication and looking forward to getting off it totally.
Okay. Merci. Okay. Back to hands up. Okay. I see Andrea. Is it same hand up or
Yes,
new?
same Andrea. I would like to know, I'm in the Cayman Islands, and I'd like to know if you shipped to the Cayman Islands.
That's you, Marva, and Dr. Clive. I don't know.
And you listen to who's gonna answer.
Allow me to ask, who is the person who invites you to the call? Can you
Pardon
hear
me?
me? Who is the person who invited you to the call? What's the name of the offline?
I'm not hearing you.
Who's
What's
the
the name
person
of,
what's the name of the person that invited you to the call tonight?
Okay, it's Vendrix, but she's in New York.
She's in New York. Oh, okay.
And I would also like to know if these supplements can be recommended for small children like 11-year-old.
Oh,
Oh.
definitely, yes.
That's a big child.
Okay.
That's a big baby.
You know?
yeah,
Yes, but
we take them on the breast.
yeah.
yeah, but
So
I would like to know if they're
I am is it the first time we're hearing about somebody from the Cayman Islands?
I'm trying to remember
Me
who is
too.
the person in the Cayman Islands.
We
So
have
we can
somebody in the
find it
Cayman
from them.
Islands.
Yeah. So you have to stay in touch with us and see who is the person in the Cayman Islands that could guide you. How did they get their products there, if they did? So please stay so we can tell you about it.
Okay. Okay.
okay.
Thank you.
Thank you, Andrea. Thanks for your patience. We know a lot, but we don't know everything. Alice.
All right. Before you get there, so there's a person. Okay, let Ellis go. Yeah, no problem. Ellis.
Okay.
Ellis Mayberry. At least somebody put up the right color hand.
You know what I'm saying?
That's a pretty good one, Dr. Desmond. Right color hand. Hey, Lotta. Hey, I'm the gentleman that's gonna live to be 106. So
Amen to that.
yeah. So hey, I just had a quick testimonial. In fact, I got a chance to talk to Dr. Roger Hill today and did a testimony that he taped and everything. But anyway,
it perfect.
yeah, it was had to do with gout. For the last 2.5 months, I've been on prescribed medicine from my doctor. My ankle from my high ankle down to the ankle bone. Looked like I was trying to be a Clydesdale horse. It was so big. And I was taking medication. I've been taking this 2 medications every day for the last month and a half, and then just the pain went away, but the was still there. And I, of course, saw this a week or so ago, and fortunately, Sandra sent me a couple of these little small jars of Rejuvenate
The
as I'm
mini.
waiting for mine to get here. And so I started putting that on there, and in 72 hours, and like I said, Dr. Hill has the photos. In 72 hours, I was almost down to normal, where a month and a half of taking medication hadn't affected it other than relieving the pain. This took the swelling and everything down to almost a normal size leg and ankle bone. So I am just thrilled to death and can't wait till my product gets here. So there's a commercial here in the United States that talks about hot sauce, and it says I put that stuff on everything. And
You're
that's what
missing
I'm
a
gonna be
word. You're
doing with
missing a
my
word in that
Rejuvenate.
commercial.
Yeah,
There's
that's
a
not the
word
word they use.
missing.
That's the word I'll use. Is I'm going to put that stuff on everything.
And everything. Just like the American Express. Don't leave home without.
Not at all.
Listen,
Thank
funny
you.
it's funny you should say that, because there was a gentleman who left home with it, and he was traveling from one area of Jamaica to the next. Hungry, had his food in his van, but couldn't eat it because of a toothache. And then he remembered he had it. Then he put it on the tooth, and within 10 minutes, he was just eating his food like nobody's business. So yes, don't leave home without it.
I don't. I
Even works on
always go
teeth.
pack.
Yeah.
Okay, wonderful. Nice to hear from you, Alice. Is there anything else we can help you with tonight?
No, honey, because glad to be here. Appreciate you. Thank you.
Thank you for being here. Okay, thank you so much. You wanted to say something, sir? Doctor?
No. I was just going with what he was saying there.
Oh no, but before we got him on, you were gonna speak.
Okay, yeah. My brother took the vaccine in 2021, and since then he's almost blind in one eye, deaf in one ear, and all of that. So a little bit more background. I would like to know his age. To let somebody else talk while Shirley just put in his age for me, and if he was on any other medication or something like that.
Okay. Alrighty. So we can speak to Candice.
Yes.
Go ahead, please.
Okay, good night. Good night.
Good night. Good night.
I would just like to know if I could get a shipment to Guyana.
Have you been registered?
Yes, I'm registered already.
Okay, so you should be able to do your thing. Do you have a shipper that you use?
Yes.
Okay. So you can go ahead, speak to your upline, and they'll walk you through it if needed. All right?
Yes. Well, my upline say he would help me with that.
All
He
right.
said he would help you?
Yes.
It's
Clinton. Yeah.
Oh, Clinton?
Yeah.
Not Linton, but Clinton. Okay.
Clinton.
Okay. Yeah, he'll help you.
Yeah.
Go ahead.
Okay.
Take your
All right.
Okay. All righty. Congratulations.
Okay.
Welcome.
Thank you. Bye.
Kevin? Kevin, you're available to open your mic, sir.
Hello?
Hello, good evening.
Good evening. I'm traveling, I'm asking a question. I have one of the product, but asking a question. I'm traveling with going to the doctor for acid reflux for the last months. And what's happening is I'm really taking this product right now because I got one of the restorer. But I realize that the acid reflux keep on coming up. So I don't know what triggering it off. Because
what time do you eat at night?
No, I stop eat at about 5, 6.
All right. See, here's the thing with these products is that once they get in your system, they are going to start fixing back the mitochondria so it start getting other stuff under control. I would like you to get the BRAGG, Bragg apple cider vinegar, and you can take a tablespoon of it, or you can just shot it, or you can put it in some warm hot water and drink it. But you just take a shot of that, and that will calm down the acid reflux.
Okay, what is it?
Bragg, BRAGG.
Okay.
But it has to, you have to buy the one that say with mother.
With mother.
Yes, with mother.
Okay, because I still get improvement from it, because.
Yeah, man, you'll get improvement, but this will definitely knock it out of the park.
Okay.
So sometimes, some things work and they have to work in what we call it agonists, meaning that they work together. And then there are some things that are antagonistic, but this will work in concert with it. And you'll get some seriously good results.
Oh yeah, so I'm still gonna start take the products here, but where can I get this? It's over counter, the vinegar?
Yeah, man. Get it should get it at any department store, supermarket or something like that. What country you're in?
I'm in Salisbury Plain, Dr. St. Andrew.
Oh, you're Jamaican. Okay.
Yes, sir.
That's what they called me.
In the big supermarkets will sell it.
Yeah.
Yes.
The big supermarkets.
Okay, that.
All right.
Okay, thank you so much, Kevin.
Yeah, man, just take a tablespoon. If you can manage it, or you can put it in a small cup of warm water and drink it. Either way.
Okay. Thank you very much.
No problem.
Okay, thank you so much, Kevin. Yvette, nice to have you. Please open your mic.
Good night.
Good night.
I would like to know about the Cayman thing too, because I have two persons in the Cayman Island and they want to order their products. I don't know about the shipping, how it works out. So I'd like to get some information about that.
Okay.
I spoke to Adam last.
Sorry, somebody speaking to me?
No, I was just saying I spoke to one of them last week and they were ready to order.
Yes.
I don't know if they went through with the orders yet. I didn't speak back to find out if the order went through. So I would know about
I'm thinking once they have a shipper, it should be okay. Because it's not going directly to the shipper. Because going directly will probably be very costly. So maybe go to their shipper. Send have their shipping address to Mormito as their shipper's address, and then the shipper will take it in.
Okay. Then
Yeah.
thank you. I have been getting results from the products to myself. I have gotten pain results. I used to feel a lot of pain every day, arthritis pain, and I've been using the products and the pains have been getting less and less.
Praise the Lord.
And my husband had a problem with his right leg from the hip go down to the ankle, and he used it, and for over 2 weeks now he's has been feeling any pain.
Wow. Is that the sciatica, doctor?
Yes. No, well, is it the back? Is it shooting down the back of his leg?
Yes.
Yeah, that sounds like sciatica. Yeah, keep using it. Yeah.
Yes, he uses it still every day.
Wonderful.
Awesome. My only problem, like somebody put it in the chat, the only problem with the Rejuvenate is that it really finishes fast.
Well, I go through one a week.
Yes.
It really finishes fast. So folks, when you're ordering it, if you don't have something specific that you're dealing with it with, yeah, man, you're gonna have to use it. I mean, if you're using it on your face for the and then under your eyes for the bags and all of that stuff, yeah, you can do it daily 2-3 times a day. But man, it goes through quickly.
I love it. I'm not gonna stop. Every month I buy extra the 4 packet, the 4 Rejuvenate plus
Yeah.
my regular stuff to get the restore.
Oh, okay,
Yeah.
perfect.
That's good.
Okay.
So I
Okay.
think it's Lou
Okay,
Gibbs now.
somebody's mic is open. Oh, 1 second. I'm gonna close the mic here. Okay, sorry about that. Now I'm confused. I don't know who's who now.
No, I think it's Lou's time.
Lou, go
Lou
ahead, please, Lou.
Janice.
Yes, good evening.
Thank you. Good evening.
Does this product help with the dry mouth, dry throat?
You said dry mouth, dry throat. Okay, so the person that with the dry throat, dry mouth, are they not producing enough saliva?
That's me. No, I'm not.
You're not producing enough saliva, so your salivary glands. You don't have dry eyes, though, do you?
Yes.
Yeah, because those kind of work hand in hand. It does. It actually does. That's your face on there. When did this start?
I've been having this for years.
And have you gone to see a doctor with it?
Yes.
And have they prescribed prescriptions? Have they prescribed some medication?
Prescription to have more saliva, but sometimes it's just too much.
The prescription
saliva.
is too much, right?
Yeah.
Too much saliva or too much for the
Too
prescription?
much saliva. It makes too much saliva.
Makes too much saliva. You'd say you're making more than your 20 liter a day. That's a lot. All right. So basically what it is then, it's about getting the hormones, the glands that are producing the buccal gland and the salivary gland. Those needs to get back into equilibrium. They need to get back into homeostasis. And that's what this product will do for you over time.
Okay.
So it does help.
Thanks, Lou.
Thank you.
You're welcome. Thanks for calling. Janice, welcome. Please open your mic.
Hello,
Hello.
how are you?
I'm fine.
Good. I'm listening to this wonderful program,
Thank
and
you.
I am calling from the Bahamas.
Oh, it's better there.
Yeah, I'm on the product, the restore, and the renew, and the rejuvenate. Now, for me, it's working good. I think it's working good.
Nice.
I was diagnosed with high blood pressure, and I wasn't taking no medication for the pressure. I was just trying to eat natural and trying to keep the pressure down as much as I can. And many times it was higher than I could have controlled it, but I still remained to be focused. But this thing got my attention, and I got it, and I think it's working good. But one thing I have experienced is when I first started taking the Restore, I didn't wait for two minutes. I just swallowed it all down. I didn't wait for it to dissolve in my mouth for 2 minutes. After I started letting it resolve, I realized now that it resolved, I realized that something else happened after I started letting it resolve for 2 minutes. It caused a lot of saliva to come back up in my mouth, and I was kind of concerned about that.
Okay, so what I want you to do is to put 1 milliliter at a time under your tongue. Don't put all 4.
Okay, one milliliter.
Yeah, so you bring it up to where it says 1 milliliter. You put that under your tongue. You hold that for 2 minutes, and then you put the second one after that, and the third one. And don't put all of them at once, because then that's exactly what's gonna happen. If you put more than one, your salivary glands are gonna start producing a lot of saliva.
But I was only doing it. Now I'm only doing it once. I didn't do it. I didn't do the 4. I never did the 4 at all. I just do it once.
You just do one at a time.
Yes, sir.
Okay.
So,
But you say you're producing a lot of saliva.
yes, sir. So what I did is I said, let me just stay off it for 2 days and see how it happens, see what happens. And
so when you put it under your tongue, do you close your mouth or do you open it?
I close my mouth and I tilt my head backwards.
All right. Yeah. All right. So what I want you to do when you do it tomorrow, when you do the first one, you put it to the right and just hold it there. So you're gonna put it in under your tongue, put it to the right side this time and hold it there. And then when you're doing the second one, you put it to the left side and just hold it there. And then see if that makes a difference. Because I find that kind of makes a difference sometimes instead of having it all around.
Now I want to ask the question because dealing with high blood pressure, it causes erectile dysfunctioning.
The medication causes that, plus the high blood pressure can cause that as well, yes.
Right. What you suggest I do?
Well, the ingredients that you're taking, this now that you're taking, it does have ingredients in it that helps with that. Because there's about 4, there's the maca, which is ingredient number 22, and there's about 3 other ingredients in there that helps with that. So over time, you give yourself some time to do that. But as I was mentioning before, I hear a female in your background. Is that your significant other?
Yes, that's my wife.
Right. So she can give you a prostate massage as well, as along with putting the rejuvenate, along with massaging the rejuvenate in your perineum. So you will lie in the fetal position, and then she is going to find that space in between the anus and the scrotum. And there's a bone there you're gonna feel that has like a hole. And then that's where she's going to massage it right there. And that is going to help with if there's any buildup of plaques or anything. For about 10 minutes, she's gonna do that massage. And then in about 2 to 3 weeks, you should start that thing should start resolving.
Okay.
When often should this be done?
Thank you so much.
Well, based on the situation he's dealing with, I would do it daily, 10 minutes a day daily.
Okay. This has been so very informative and very helpful. Very helpful. So, you recommend that I stop taking the medication for pressure?
No. I let your GP do that.
Okay.
Yeah. Take the medication. Which medication do you have? Let me find out. What's the name of the medication you have for your blood pressure?
Covaran.
You should have another name. You should have another name on it. I'm not good with the generic names. I'm good with the medical names. Does it end with OLOL?
No, it just have Covaran.
Spell that for me. Let me go into my stuff here. Can you spell it for me?
Yes, sir. Go ahead. COVERAM.
Do you have heart disease?
I hear you.
Do you have heart problem?
Yeah, so that's what the doctor say. He said because I wasn't taking nothing for high blood pressure, it caused my heart to function too hard on one part of my heart. He said,
and that's the only medication you're on?
Yes, sir. That's
Marva.
Yes, sir.
Could you put the spelling in the chat for me? AMI.
Joy is there. What Joy? Joy.
AMILO. AMILODIPINE.
You got that, Joy? Okay, I don't see any response from her, so let me do it then. Sorry.
Okay, sir.
You got that, amlodipine? I want you to ask your doctor to change your medication to that one. They're typing it in the chat. Yeah.
Okay. I also take spirulina, spirulac. What is it?
Oh, spironolactone. Okay. All right.
Yeah, spirulactone. I take half of this tablets every night with that one.
No, I would like you to change the I'd like you to change that Proveram thing to amlodipine.
Okay.
Sorry, I don't see Joy put it up, so I'm so sorry, Doctor. You have to repeat yourself. But can you please spell it again?
Yeah, she typed it in.
Oh, I didn't see it. I'm not seeing it. Oh, there it is now. I'm so sorry. Sorry, Joy. Okay. You got it. You got it, sir.
I just want amlodipine. I don't want the other one. Just amlodipine.
Yeah.
Okay. You don't type it in the system.
Yeah.
You don't put it in.
Yeah, it's in there. Just do amlodipine. Ask your doctor to change it to amlodipine.
Amlodipine.
Yeah, it's written in the look in the chat. You'll see the name.
Yeah. Okay. My wife will check it out. But thank you so much, sir.
Yeah, you're welcome. Because amlodipine also is what we call a vasodilator, so it opens up the veins as well. So that will also help with the erectile thing. But there's another one here now.
Okay. Okay. Thank you.
Okay.
Thank you.
Thank you. Okay. Did you want to go back to the other? Did you want to go back to the other one, sir? Where you ask?
Which other one? Yeah, I don't see. Did the person put the age and stuff in there? Why don't they just come on it? Did they put the information in there?
I'm looking. I don't think so.
All right, so just go back to Yvette then.
Okay, Yvette. Yvette, go ahead, please.
Yes. I'd like to know, I have a cyst on my hand, and the doctor said they would like to operate on it on the 27th of this month. And
which bone is it? Which bone is it beside?
It's on my right and beside my thumb. Right.
Oh yeah. Oh, it's let them take it out. It's what we call a ganglionic cyst. Yeah, let them just take it out. It's not a biggie.
Okay. But they were saying that it might damage my vein.
Yeah, because of That's why I asked you, where is it? Which bone is it next to? So yeah.
I can just take it out and then I use the products and rub it.
Yeah, that will make that. Yeah, that will clear up the scar tissues and all that. Yeah.
Okay. Another thing, I've been trying to exercise, but I have this arthritis pain. My hips hurt very much.
Right. So just deal with the pain and the discomfort first before you get into the exercise. So yeah, are you overweight?
Yes.
Okay. So are you have access to a swimming pool or the beach?
No.
Okay, so those would have been nice substitutes.
Oh yes, because I love exercising in the water, but I don't get to go that often because it's not near.
Oh, okay. Sorry about that. Yeah, so you want to deal with the restore, rejuvenate thing first to kind of start regrowing back some of them ligaments and tendons, so to get rid of the discomfort, so then you can start back your exercise regime.
Okay. Because even when I lie in the night, like if I use a fan, I have to cover up my knees with the pillow or something. It hurt right through the night. If the knees, if the
Are you
bruise
on the product? Are you on the product now?
Yes, I am on them.
How long you been on it?
I have been taking it from April, but I didn't get any in June
Oh.
and in July.
Mm-hmm.
So I hadn't I did the subscription, but the products didn't came in June or July.
Yeah, they were having distribution issues back then, but that all seems to be sorted out.
Okay, so I didn't get any restore in August. But I got a package since week, so I have the restore now and the rejuvenate. Okay, good. Sorry about the delay. We all suffered through it. But I should not exercise right now until I
Yeah,
get up.
yeah, because you're just gonna aggravate what's there. So now just deal with the therapeutic stuff now, and then the exercise will come later.
Okay, thank you.
All right. So the question she had asked was, because she did put their ages up now, which makes sense. So the question again, vaccine 2021, almost blind, 1 in 1 eye. All right. So so what she gonna need to do is that the Restore Rejuvenate really works well when you massage the ear temple, and you can drop some of the Restore itself, not the 1 milliliter or something like that, but just a tiny drop, and just let it get down into the ear, and it will kind of help to start repairing some stuff that's going on down there. Because we have seen and have heard persons who have actually start hearing again. The thing with the eye also, depending on what's going on with it, we also want them to start using it on their eyes, because the eye is one of the organs that have a lot of mitochondria, and persons are getting great results from that as well. So yeah, it will help. It will definitely help. You just gotta try it.
Wonderful. So,
Daphne,
Miss Daphne. You can open your mic, Daphne, please. Okay, go ahead, please. You can speak. We're not hearing you if you're speaking. We're not hearing you, but we see that your mic is open.
Hello?
Hello? Yes.
Hi,
Hi.
this is David.
Oh,
Yes, hi, doctor.
you
hi, how
see,
you?
you confused us. You didn't even raise your hand. So we wonder who's this?
I,
Dr. Southstone.
I'm calling on behalf of my wife. She had a stroke 4 years ago. She's not speaking now, other than maybe yes or no. So 2 years after the stroke, she developed a cough, a perpetual cough. She's not able. It seems as though her saliva is going down and forming a lot of mucus. She had to be hospitalized in 2 months for pneumonia. So pneumonia is forming down there because of her inability to swallow. I'm using a thickener thing now to help, with the fluids going down there. How can I help her to get rid of this pneumonia?
So she's having an aspiration pneumonia,
Yeah.
because when she swallows, it goes back down and
Yes.
forms. And that pneumonia is on the right side, right?
On both sides.
On both sides, as usual.
Yeah.
Okay, so she have to, number one, she got to use the thickener in order to prevent all of that, like you just said. But I think, so which side did she have the stroke on?
Well, the stroke is not she has aphasia. Her limbs are fine. She walks, it hasn't affected her.
Oh,
her
okay.
limbs.
Oh, okay. All
Yeah,
right.
the
So
aphasia,
so basically I am thinking that we need to start. How do we get the restore under her? So her mouth open, she eats okay and all of that.
Oh yes, he eats and drinks. It's just that some of the liquids seem to be going down there and creating this pneumonia.
Right. So now you have to, well, the Restore actually is, the Restore is sublingual, so it's going to be absorbed into the bloodstream under the tongue, which is a good thing. And then now the chest is where you're going to have to do a lot of the massaging with the chest and with the Rejuvenate.
Okay.
Let me just think here quickly. You remember what side she had the stroke on now?
Well, no, as I said, it's in her brain. Once they're looking on the computer, it was a massive stroke. It's in her brain. The blockage there in her brain that's preventing her from communicating, other than few words here and there.
Okay, so now the reason I was asking that because I want to know which side of the head to tell you to pay more attention to.
Oh, okay. Well, I'm not sure at this minute, doctor.
Oh, okay.
But I could find out. Yeah, I'm sorry.
So which limb is weaker than the other when she walks?
Initially, the right leg, but that seems to be dissipated now somewhat.
Right.
But
so now we know where now I know where the infarct is. So the infarct is in the left side of the brain. So right above the ears there, a little bit to the back. That is where you need to do the massaging, because that's where the infarct is in the brain, right there. It's on the left side, yeah.
Okay.
So you just have to massage the Restore Rejuvenate there, and then give her the Restore under the tongue, and just be patient with her. And just in her case, I don't want you to tilt her head back because of what's going on with the stuff. I want you to just keep her head level, and so that the thing absorbed without any issues. You might have to take a little bit longer in her case, maybe 2.5 minutes, but then to get it totally absorbed. Right.
Okay. She sleeps on a almost upright position. Actually, she doesn't problem sleeping. Yeah. But finally, the last thing I want to ask you, doctor, so regarding the consistent pneumonia, what do we do?
So with what are they giving her at the hospital? What do they give her?
They give her antibiotic.
Antibiotics.
Intravenously.
Intravenously, yeah. That's what's gonna see. The problem with that is that because there's a lot of weakness going on there, now we just have to hope that this regime that you will start her on with the Restore Rejuvenate will bring back some strength there.
Yes.
Because what happened with the epiglottis, every time, because as soon as something hits the back of your throat, the epiglottis tends to want to open up, even when it's not supposed to. And so there also needs to be sorted out. So you have to do a lot of massaging on the neck, so that will strengthen the laryngopharynx area. So that seems to be some weakness going on there.
Okay, doctor.
All right.
Thank you so much, sir.
You're welcome.
Okay. Thank you. Daphne, sorry about that. Go ahead, please, now, my dear.
Okay. Dr. Samuels, can you hear me?
Loud and clear.
Okay. Thank you for all the information. Very informative. I do enjoy these calls. I learned so much. But my question is, do you have any record that a side effect of the technology causes hypertension?
I have one person that said that. I have one person but she is on like 4 or 5 different medications, and she said that there was some hypertension that was happening there with it. But the ingredients that I read upon and that I study, most of them does reduce the blood pressure. So something else I'm sure is going on with her in that regard.
I do believe it. It might be just coincidental. But she said she had to stop with the Restore.
Yes.
Her pressure was so high.
Yes, I have one person like that too from Ajax, Ontario.
And she did say the pain is better. The pain that
Right.
she was having is much
Right.
better.
All of that was good except the hypertension. So I was telling her instead of doing the 4 to cut it down to 2 and then see what happens. But I haven't heard
That's a
back from her.
that's a good idea.
Mhm. But
Okay.
yeah, cut it down to 2 and also get the renew the brain and body and see how that works.
Yeah.
But I would cut it down to 2, and so I told her to cut it down to 2 and then monitor the blood pressure because but
Yes.
something else is going on.
Yeah, I think so. I think it's just coincidence, but anyway. Thank you, sir.
You're welcome.
Thank you, Deb. I see 2 more hands
Thank
up.
you.
There's gonna be the last 2 hands, please, for the night. We gotta talk the doctor in tonight. Okay, so Flo Lady, you're up, please.
Hi, good night, everybody. Good night,
Good night.
doctor. Good night. Yes, I just want to just chime in and just give some testimonials about the product, just some follow-up and updates, right? Where my brother-in-law is concerned, the one that had the stroke in
Yes.
June. Today, I could hear my sister gave a report that he did some tests, and the cardiologist, said that, his vitals are good. His vitals are good. And I can say what we started to do, because she was a little bit hesitant in giving him the restore because he was taking so many meds. So she was a little bit hesitant, but I encouraged her with my other sister, told her to just give it under, put it under his tongue. And she's been doing that. And the results are amazing, because also he doesn't even want to use a wheelchair. He's showing persons that he can even walk without using the cane,
Wow.
So yeah, it's really, really amazing, along with her and everything. But I really gonna attribute his fast recovery for Mito products. It has been working tremendously on him. And I would just encourage the gentleman that just called about putting it on with his wife, because I did my sister to do it like every 3, 4, 5 times a day while he was in the hospital and she was there at his bedside, just to rub the Restore and the Rejuvenate cream on the left side of his head. And she's been doing that, but I can say that since she has started to really increase the Restore in on giving him internally, it's been good. His vitals are good. So, and another update from the lady that called about the 1-year-old who had the seizure and was giving him the Restore. She really stopped. She gave him the break for the 2 weeks where the Restore is concerned. But she's been doing that, which doctor said that she's to just use the Rejuvenate cream on him. And she said that today, I just text her. She said that he's been sleeping really better and he hasn't had any strong seizure since then, since that was Thursday, Friday of last week. Yes. And also he's been smiling with her more. So listen, this Rejuvenate thing and the Restore and it's just amazing. And I still have my testimony with my client who was to be on dialysis machine, went into UA last week to be on the dialysis machine. And the doctor told him his blood works are good and stuff. It doesn't need to do that, be on the dialysis. He's to go home, continue to do what he's doing. What I'm really waiting on is a blood test proof. So when I have that, then I can say, listen, I can make the full comparison. But he is doing great. He's been really, really doing good. Just the fact to know that he doesn't have to be on a dialysis machine. He's just really excited at giving God thanks. He will be on the calls. We'll just need to set him up properly. But I can say, just want to really just chime in tonight to say, listen, the More Mito products, they are amazing. They are working. Persons are getting tremendous results from it. So just continue to take it, be patient with it, and just be consistent. Have a wonderful night. And again, Dr. Samuel,
Not a
really been
problem.
a blessing.
Before I take
Yes.
Janice as the last person for the evening, to speak to the doctor. I just want to big up Chess in the place. You see, the thing about the products are wonderful, but you know, when you come and you learn how to use them well, that is one of the amazing things that we learn so much. So we're able to deliver this to tell people about what so we might not have what they have. And so it's good that we pick it up here so we can tell them enough for them to come to the doctor, for the doctor to finish it off, to finish off the story. So thank you so much, doctors. Dr. Campbell with the microbiome and Dr. Samuel with the mitochondria. Thank you so much. So go ahead, please, Janice. You can open your
Okay,
mic.
good night, good night, good night, everyone.
Yes,
And
good night.
thank you so much for taking the time out to share on the product. You don't just make it available, but you come on and you teach us about it. Now I have been taking it along with my husband and I have seen exponential results. Before taking it during the summer, I was complaining to my sisters of feeling so tired and lethargic, and I just was so tired and had no energy. But taking this product, I have seen my energy level being restored. I am no longer feeling tired, and I am working, and I am feeling super, super good. So thank you so much for this product. And I just want to continue to take it. I have no serious conditions going on, but I am taking it along with my husband as a preventative measure for what I probably may not know that's going on in the body. I have one question for a cancer patient who I was able to get it for. And she says that when she takes it, when she takes the Restore, it makes her feel bad. And so she stopped taking it. And she said she just puts it in the a drop of the liquid into the Rejuvenate, and she massages the area where the lump is.
What kind of cancer is
Do
it?
you
What kind
know?
of cancer are we dealing with?
She has breast cancer.
Breast cancer.
Mm-hmm.
Mm.
And they have put a
Do you,
port in, and she's taking chemo treatment.
did she have
So she says,
she had a surgery already?
no, sir. No.
All right, I would still prefer if she still takes the Restore to give her a real fighting chance. So listen, what you tell her is this: tell her to take to spread it out instead of taking maybe 2, 3 at a time. Just do one now and spread it out throughout the day. Take one 4 hour later, another 4 hour later, or so on. So, because she need the Restore as part of the fight.
Right.
You tell her
Okay.
it's not to swallow; it's sublingual. Tell her to take it under the tongue.
Yeah, we were taking it wrong initially, but then
Yeah.
when we were, yes, so now we started taking it correctly, and she says, this makes me feel bad. So she stops taking it. So I'm like, oh my
No. Tell her
God.
to go take it, take one and spread it out over
Spread it
4,
out.
or maybe every
Okay.
3 hours. Yeah.
Okay.
Just
All
take
righty.
one every 3 hours. Yeah.
And a sad thing about it is her daughter also now has the cancer in her breast. Oh God. And so what the daughter is saying is she's tired taking chemo, and she went to America she wanted to take off the breast and to rebuild it with tissue from the stomach area. And I was so against it. The only thing is to get her to take the product is the problem. She yeah, I don't know how to make her see the light in that, but
Can't you
yeah,
come to the call?
I probably
Can you get her to come to the call?
I will try. Yes, sir.
Okay, do that.
Okay, thank you
Okay.
so much. Thank you all. Thank you so
Thank you so
much.
much.
I appreciate everybody who has spoken here tonight. And no long speech from me, Dr. Campbell, Dr. Biome, microbiome himself. Please, sir, step up to the microphone and have a wonderful night.
Great, great, great. Wow, what a call tonight. We came to the university and we hear the professor himself, Dr. Desmond Samuel, the varied amount of questions and the amazing answers, testimonials left, right, and center about babies and grannies, all the spectrum. But we just want to thank you for shining in. We thank Sir Townsend for the platform as usual. We thank Dr. Samuels for coming and sharing. Friends, what you are getting from Dr. Samuels for free, you'd have to pay hundreds of US dollars for this. So be grateful for the goodness of the Lord for providing such eloquent answers, timely, knowledgeable answers for the questions that you have posed. Thank you again, Doc. On behalf of everybody on this call, we thank you. Somebody, Yvette Francis, I see you applauding that the testimony from Flow Lady. And thank you, Flow Lady, for being a kind human being to share with your friends and family and everybody here who has ever opened their mouth, shared with someone. Thank you. We thank you for coming. You know, Friday, um, today is what? Wednesday. So Friday will be the next call, 7:30 Jamaica time. You can feel free to invite friends and invite families to come. And we pray that all will be well. The doctor will be here so that he can do the major presentation as usual and then find time to give answers. So this is good. This is simply amazing. Hear the testimony. God is amazing. He sent his word and he healed our diseases. What a time. So we just want to thank you. Sorry, thank you all for shining in and for making tonight the night it has been. Thank you, Lady Marvel, for hosting this section so proficiently. Thank everybody for asking Joyous. We thank you for typing in the room and clarifying issues. And we just thank you all. And let us do it. Let us do it again Friday all over again. The Lord tarries and our lives are spared. And we just want to give God the praise. We can keep the checks from the company, but we just want to give God the praise. So he's good. So as we close in prayer because we have to thank God for what he has sent to us. We asked for it, and he has sent something that has even surprised us. So as we close in prayer, we say, Father, thank you. Thank you that your goodness keep running after us. Thank you, Lord, for the way you have blessed us. Thank you for the many persons who have shined in to say that they have gotten some help. And even those who are not able to open their microphone, still watching something, may you continue to help them. Bless them. Bless every family. May we be kind to mankind as we're in a race to help the human race. Bless Dr. Samuels and his family. Bless all persons here. Watch over us. Cause us to have a good night's sleep. We say thanks. In Jesus' name, amen. Bless you all. See you again on Friday, if it's the Lord's will, and we will turn up and see how, as Doc shares, we can continue to bless many more persons. Thank you.
Be blessed, everyone.
Thank you. Be blessed too. Hey, great.
Yes.
Thank you so much.
Good night. Good night. Blessings.
Bless you. Bless a lot of persons in the chat room, Doc Samuel. They are telling you, thank you, sir, for the amazing presentation. So much information. How to use the product. Wow.
Yeah.
Amazing.
I didn't know. Did somebody shake him down? Because he's coming up with a lot of stuff these days, man. Alrighty. Thank you, guys. Have a good night rest and be back
Yes.
on Friday. Take care.
Friday.
Love you all. Mwah.